ACL tears are an incredibly common injury. They're much more common in women than men, and we've learned that women, depending on the sport, are up to 6 to 8 times more likely than men to tear their ACLs, and often this involves teenagers. My approach has changed over the last 20 years. 20 years ago, I was using a patellar tendon in most cases, which involved 2 metal screws to fix the graft in place, and then the body has to grow into that tendon and make a ligament. Nowadays, in most cases, I use a single hamstring. We have a way to do it called all inside, where we can quadruple that hamstring, which makes a much stronger and larger graft, and the morbidity or the downside or what you lose from taking one hamstring is minimal. What's happened over the past year is the FDA-approved the Bear. The Bear is a bovine collagen implant where we put it in the gap between the 2 ends of the ACL. That's super exciting because there's no donor site morbidity, meaning we're not taking the patellar tendon and we're not taking the hamstring, and instead we're using the patient's own growth potential to heal that ACL. And we got approval at HSS in February to start doing this operation. And so far I can say their knee feels very stable, but it's a little bit slower rehab the first couple months. And I'll report back in a year and see how those patients are actually doing. But I can tell you, to get through the FDA, they had to do a lot of work comparing regular ACL reconstruction to the Bear, and the results were very promising.